Studies show that 80% of Africa's population still rely on traditional medicine for their basic healthcare needs. In keeping with this reality, a lot of work is being done to promote and integrate it into mainstream health systems. This week on the program, we ask, why is traditional African medicine still dominant? And what is being done to mainstream it? I'm Beatrice Marshall. Welcome to Talk Africa. Well, members of Kenya's Maasai community have relied on herbs for centuries to heal and protect their bodies. Their knowledge of herbal medicine has been passed down through generations. Before our discussion, let's take a look at the report by my colleague, Enoch Sikolia.
Meet Tumpes Oleleholia, a respected herbalist within Kenya's Maasai community. He holds the key to the intricate world of herbal medicine. Tumpes Oleleholia not only understands the properties of each plant, but he also knows the delicate art of combining them for maximum effect.
It freshens our bodies and it's good medicine. In fact, it treats like 7 illnesses.
One of the most fascinating aspects of Maasai herbal medicine is its preparation. Oleleholia meticulously blends the herbs, often using time-honored techniques. He prepares the herbs by heating them in a pot. He then mixes them with a soup made from goat heads and lets the mixture simmer. The soup adds a unique flavor to the herbal mix, making it more palatable. Bitter medicine can be tough to swallow, he says.
Our ancestors passed down this wisdom to us. I was a community warrior, and while in the forest, I learned the art. Each plant has a purpose: to heal, to strengthen, to purify.
A majority of the people from the Maasai community here in Kenya advocate for the power of plants. They say they rarely get serious illnesses, and it's because of their intake of herbs.
First of all, it is available. It is available. We have it in plenty, and we've seen from generation to generation. That's very important.
Kashu, a primary school teacher, is happy that the world is realizing the importance of traditional medicine in enhancing global health.
Compare us and also the Chinese. They're using medicine. So it's only that we've not compared it medically, but in actual sense we see, because if I'm sick and I'm taking this one, then I get healed. So what else do I want to? It's just like the other one from the hospital.
They say that some of the herbs you use are yet to be scientifically proven, and hence their medicinal value are not established. What is your take on that?
Even if science investigations are done on my herbs, I am sure they will be given a clean bill of health. And if they are found unfit, I will accept, but I am certain they are okay.
Well, let's now bring in our panel of experts. Joining me in Nairobi, Dr. Atunga Nyacheo, Senior Research Scientist at the Institute of Primate Research. From Accra, Professor Benoit Banga Ngwesan, a traditional health practitioner. And in Abuja, in Nigeria, Hajiya Zainab Ujudud Sharif, traditional health practitioner. Welcome all to the program, and thank you for joining in this discussion. Professor Ngwesan, let me start off with you, because you're the director of the Institute of Traditional and Alternative Medicine in Ghana. You have vast experience in that field for many years. What is the status of traditional medicine in Africa?
There is an importance to cultural heritage, which means that we had some knowledge, we had some solution to our health issues in Africa years and centuries ago, and this knowledge has been transmitted from one generation to the other, and today is kind of, there is a loss of this knowledge of how our ancestors were handling their disease conditions. Thank God there is an increasing recognition of the traditional medicine by our health systems. In most African countries, I think politicians are now trying to integrate traditional medicine into the national healthcare systems.
Give us the simple aspects of it. Who exactly is using traditional medicine today?
80% of the population in Africa are using or relying on traditional medicine for their healthcare needs. And there are reasons for that. The first reason is the accessibility. It is easy to access, and there's also the affordability. They come with low cost. And you know that in Africa, most countries are facing reduced numbers of hospitals and a reduced number of pharmacies. So even when people are willing to, they don't have hospital nearby their location. So these traditional herbalists are part of the community, right, and most of them are well known by the patient. So usually when they have issues, the first people they will refer to are the traditional healers.
Right.
And this percentage I gave, the 80%, even increased to 100% in rural communities where the facilities are even scarce as compared to the urban areas.
So let me rope in Zainab here, because I want to hear your perspective as a traditional medical practitioner. Zainab, how do you diagnose illnesses and the exact appropriate herbal medicine to be used? Because as we've heard from Professor Ngwesan, up to about 80% of the populations in Africa now use traditional medicine.
I need to discuss with the patient, what is your problem? How can I understand? And with my knowledge of medicinal plants, so many biodiversity in the management of any particular ailment, God has given us so many medicinal plants. As an expert and as a scientist and as a pharmacist, I'm able to identify the medicinal plants that have the affinity to treat that particular ailment, right, and advise accordingly and treat accordingly. This is the difference we have with the modern scientists, the pharmacists, the practitioners who have gone to add value in their training so they can, however, I want to state that categorically. The real practitioners are traditional scientists.
Right.
They are on their scientists. But the modern logic with the traditional scientists, we go a long way in improving the quality and diagnosis and treatment of more than 80% of our people who rely on them.
Let me rope in Dr. Atunga here. Dr. Atunga, I want to hear more about the research, because what we are hearing from the other panelists is that, 80% of Africa's population now today still uses traditional medicine. What is the research saying? Are there research findings on the benefits for people and for Africa's healthcare systems in particular?
Actually, I have interacted so much with traditional healers, and the idea is actually to add value to what they are doing, because you realize that these traditional healers, they have herbal medicine, which they only sell to a limited number of people because they do not have scientific data that adds value to what they are doing. And the scientific data we are talking about here is efficacy, just to prove that scientifically the herbal medicine works. And also we are talking about safety, because everybody wants to take these herbs, want to know whether they are safe, and also the dosage. I think those are the issues that we as researchers are looking for. And we have interacted with them, and rightfully, as it has been mentioned, actually in Africa, most of the people, once they get sick, it's like the first line of treatment. They go to the traditional healers and they explain how they are feeling. And these traditional healers, of course, based on their experience for many years, they are able to prescribe some kind of herbal medicine depending on the symptoms and signs that they observe, or how the patients are feeling. So this is something that has been going on for many years. And based on our experience is that we have tested various herbal products.
Right.
And majority of them actually have indication that they contain some active ingredients that could cure diseases. However, these profiles need to be put out there so that because there are some people who are a bit skeptical with the herbal medicine because of the information, lack of information. So our role, we as researchers, is actually to add value to what they are doing.
Right. So I want to find out, because you're talking about adding value in terms of the issues of safety, of traditional medicine. What does your research show?
Research show that some of them are safe and some of them may not be safe depending on where they are obtained. For example, some herbs actually grow in areas where massive pesticides have been used. So once you do profiling and you realize that this one contains some pesticides, then probably that is not safe for use. But some of them grow in areas that are clean, and we can see that they do not have any effect on the liver and the kidney profiles, which are very important indicators of safety. So in adding value, we mean that those herbs that we find that actually they do not have any effect,
right,
then we are supposed to provide that information in terms of labeling and say these herbs have undergone scientific validation and we know they are safe. Safety is very important. They could be having efficacy,
right,
treatment, but in terms of safety, we need to provide that information as researchers just to increase confidence in the use of these herbal products.
Professor Nguesson, I want to find out what the rest of the communities think about herbal medicine. What is the WHO, the World Health Organization's position, for instance, on traditional medicine?
As the other speakers said, traditional medicine is there, and it will be there for forever. So WHO couldn't also make a different constatation. They realized that Africans are relying on traditional medicine. So they decided that let's regulate the practice and the product. So we're happy to know that WHO is now encouraging the integration of traditional medicine in the national healthcare system. But as Dr. Atunga said, it needs to be regulated. In Ghana, for example, the practice is regulated, the products are regulated. And in terms of safety, all the toxicity tests and efficacy tests are conducted before the herbal product is approved for marketing. So the regulation of this practice is very important. And
right,
this is what WHO is also encouraging. And our leaders are also trying to put in place the necessary measures that can bring traditional medicine at the level of the Orthodox medicine, the Chinese traditional medicine, or the Ayurveda Indian medicine.
Just to further add a point on the recognition of WHO that has recognized the three healthcare systems: the traditional medicine, the indigenous medicine, and then the complementary and alternative medicine, and of course the orthodox medicine. That means the three are recognized and the three can be implemented to manage patients. And what is important is that there has to be effective collaboration. In terms of orthodox, as a pharmacist, we know we are looking for the active ingredients to produce a drug. But for herbal medicine, when you talk of a dosage, with this research so far done, with the modern practitioners, they have begun to realize the importance of dosage and they have given dosage. So we should stop discrediting African and say that we don't have those. We have those because the components of herbal medicine, which has multi-components, is not the same as orthodox medicine. So the different dosage has to be applied. This is very important. And what is more important is that gradually, because there must be regulation that we all agreed. For us in Nigeria, we have a regulatory body that lists the safety of herbal products. When it lists it, it allowed the usage for 2 years, and then lists it again for further 2 years. And then we begin to look at the issue of clinical trials. We know the challenge we have is clinical trials. because you need to have a lot of finance. We need the political will of all our African leaders. They must be able to provide funds to research. We cannot continue to rely on donor agencies to support our own research, for goodness sake. Let us support our own research, get the funding, so that Africa can produce its own medicine for its own people. But like all the researchers have said, we have produced so many encyclopedia of medicinal plants in Africa. What again do we need? All we need to do is to look at those research works. You see all the professors, all the doctors, you do researches and keep them in your shelf. No, we need to bring them out and take research to products. That is what we should encourage. But what the researchers need is to support them in funding.
This brings me to the point, Professor Ngwesan, when we talk about striking a balance here, as Zainab has talked about, between conventional medicine and traditional medicine, can we strike a balance between the two for the benefit of the healthcare systems in Africa?
There shouldn't be any competition between the three medicines. There shouldn't be a competition between orthodox medicine, traditional and complementary and alternative medicine. So each one of them comes with its strength and its weaknesses. And this is true for orthodox medicine. This is also true for traditional medicine. So I think the limitation of one should be compensated by the other. So, for example, when it comes to incurable diseases, according to the Western medicine, our research has shown that some of these incurable diseases are perfectly managed by traditional medicine. So in that case, we are recommending a collaboration between the two medicines to refer the patient to the traditional medicine that can handle and manage this condition. And I understand the concern about traditional medicine, but Zainab was also clear on the point. These concerns are also true for orthodox medicine. We have side effects with orthodox drugs. We have low efficacy rates with some orthodox drugs. We also have side effects with traditional medicine, and we can also have some limitation. So I believe that being in Africa, we should give the priority to our medicine. This is our medicine. This is an African medicine. Our ancestors were using it. They were able to survive all these centuries. So what we are asking now is to add the science to it, because today everybody agree on scientific methodologies, and we agree that we can use the scientific tools to assess, study, and investigate the medicine. So this is what we are doing now.
An interesting discussion indeed. But on that note, let's take a short break. When we come back, we will look at efforts to mainstream traditional medicine, the opportunities and the challenges. To stay with us. Welcome back to Talk Africa. Let's continue with our discussion now. Still with me in Nairobi, Dr. Atunga Nyachieo. In Accra, Professor Benoit Banga Ngwesan. And in Abuja, Hayiya Zainab Ujudud Sharif. Well, let me start off with you, Dr. Atunga, because I want to talk about the opportunities and the challenges associated with the use of traditional medicines. Where are the opportunities and the challenges? What are the arguments for and against the use of traditional medicine?
When I look at traditional medicine, I think we have quite a lot of opportunities there. From our case in Kenya, the issue of traditional medicine became more appreciated during COVID time, because during that time, nothing was working, and most people resolved to take traditional medicine. And there are many experiences to show actually that this traditional medicine may have contributed to the healing of this disease. So I feel that we have much more opportunities. We have diversity of plants. We have herbal medicine all over. We have traditional healers. We have the knowledge of indigenous medicine that has been passed over generation and is with us. The only thing we need to do is add value to it, provide scientific data, and integrate this actually to our health system. For me, even the conventional medicine that we have, majority of them come from the herbal plants. Like, for example, the malaria drugs that we use, it came from the artemisinin-based plants. So really, we can even derive our industry in terms of producing medicine just by appreciating the traditional medicine. African governments must allocate funding to support traditional medicine in terms of research and in terms of all systems that are required to integrate it into the healthcare. Because nobody is going to provide funds from outside to support our problems. It is we who are supposed to fund ourselves internally, prioritize the challenges, and then be able to support the system, support the research, support the integration, support education, giving knowledge to these people so that everybody knows that actually when we have more information on the herbs in terms of safety, profiling, in terms of efficacy, in terms of dosage, it is of big value because now this medicine can be used locally and internationally. So I think those are some of the issues that I feel that once we address them, we should be ready to move forward.
So Zainab, let me come to you with the loss of biodiversity, because we know now that Africa's population many of them are based in urban areas where we don't have the same traditional trees and herbs that we did in days go by. How are you dealing with this loss of biodiversity? Where else are you sourcing your medicinal herbs?
You see, that is the issue of conservation and preservation of medicinal plants. And every government or every country should be able to set up institutions that can take charge of biodiversity in terms of conservation and preservation. And also, like he has said, one of the benefits, the opportunities is that when we promote our traditional medicine, it will stimulate massive cultivation of medicinal plants. So when you begin to cultivate the important medicinal plants, you are indirectly and directly supporting the biodiversity and reducing even the effects of climate change. Not only that, we Africans can be able to have homegrown solutions to its own problems. And furthermore, the research will be further stimulated to bring more raw materials for the pharmaceuticals, when we know that 45% of our modern medicine comes from plants. So with this support, we can be able to look at the area of conservation, we can be able to look at the area of preservation. And more importantly, the practitioners, we will have effective collaboration and take issues of what we look like what we know as intellectual property rights. Their intellectual property rights will be guaranteed, because they always see that when you invite them for research analysis, they feel we are taking up their knowledge. But there is a system to strengthen the intellectual property rights. And for Africa, we can also, at the African trade zone, we can be able to bring our medicines that are African, medicines that are from the plants, and we can facilitate the achievement of what we call the universal health coverage. If you don't strengthen these three healthcare systems, you strengthen the orthodox, which we know we are doing, we must strengthen complementary and alternative medicine, and we must also strengthen our traditional medicine. Don't forget, my traditional medicine in Nigeria is complementary medicine in Ghana. So if we have this synergy, it will go a long way in improving the healthcare and the quality of our people. We need to have a better life expansion, just like the Chinese and the Indians. They are able to promote their own and give them an identity. The Indians call their own Ayurveda. The Chinese call their own Taoism. What do we call our own? We must identify our own for Africans before we look at the international standards.
All right. So I want to get your closing comments here, but let me start off with you, Zainab, because I want to know what the future, what do you see as the future of traditional medicine in Africa is? Where do you see traditional medicine going in Africa?
The future of traditional medicine is very, very bright, because we have seen the challenges in orthodox, And we need in Africa to get more raw materials for even pharmaceuticals. And the only way we can achieve this is to collaborate and do more research into our own local medicines so that we can have more raw materials. And I see the issue, especially in Africa, we are going to come up with solutions to chronic ailments from our biodiversity. All we need to do again is to support research. And I see already the integration going on, either informally or formally. The policies, the government angle, the documents, the production of what we call pharmacopoeias, where we have our own indigenous plants based on scientists, is going on. I see the establishment of regulatory agencies, and I also further appreciate the setting up and the coming up of local production of our medicine, either as herbal medicine, phytomedicine, nutraceuticals. This has go a long way to go so that we can be able to use. And I see the interest of our people, especially in trying to ensure that we keep our heritage in herbal medicine. And of course, I see the practitioners coming more nearer to the government to be able to see a synergy so that they can share their knowledge before they pass on. It will be a great loss to Africa if all these practitioners that have bundle of knowledge, we don't come to them, respect them, appreciate them, and recognize their role, and in terms of intellectual property rights, guide them. We scientists can only be theoretical, not practical. We must bring the products to our African populace, and I think we'll go a long way. I see Africa exporting its own raw materials to foreign countries because of the obvious reasons. We have our organic medicinal plants, and I see us facing the challenging of climate change through the issue of biodiversity, preservation, and conservation.
Professor Ngwesan, your thoughts?
As far as they are Africans, African traditional medicine is going to exist. Now, there are more and more concern about traditional medicine. We also know how to address these concerns, and these concerns are mostly about their safety, their efficacy, and their formulation, the dosing. And there are many researches that have been conducted on traditional medicine. So I see a bright future for traditional medicine in Africa and worldwide.
All right, Dr. Amunga?
I think we cannot run away from traditional medicine. We know that we have chronic diseases that have no drugs. We know that most bacteria are undergoing resistance to antibiotics, and we don't have alternatives. So as it is now, alternative medicine, traditional medicine is the way to go. I see Africa developing a big industry out of traditional medicine. We have the materials, we have the knowledge. So if the scientists, medical doctors, and governments, and also traditional healers come together with effort we are making and inculcate the positive attitude towards traditional medicine, I think we can improve what we have, and we shall help our people. Thank you. And
we are ending on a very positive note there. That's all we have time for on this edition of Talk Africa. A big thank you to our guests, Dr. Atunga Nyachieo, Senior Research Scientist at the Institute of Primate Research, Professor Benoit Banga Ngwesan, Traditional Health Practitioner, and Hajiya Zainab Ujudud Sharif, Traditional Health Practitioner as well. Remember, you can be a part of this conversation through our social media platforms on Facebook and X, formerly Twitter, and you can watch this and other editions of Talk Africa on our YouTube playlist.